We are back with another episode of Medical for Dummies. Medical stuff, easily explained. And remember, hit the like button if you want to become smarter than your general practitioner. And most importantly, this is no medical advice. Always check with a doctor or call the emergency services when you're in urgent medical need. Today's subject is about COPD. But what is COPD? COPD, a long-term lung disease known as chronic obstructive pulmonary disease, is becoming a global health concern due to the fact that it is getting more prevalent, is responsible for a great deal of sickness, and is very expensive to treat. COPD is a progressive lung condition that causes excruciating discomfort and is characterized by shortness of breath, coughing, and production of sputum, as well as breathing restrictions that remain for an extended period of time. Chronic bronchitis and emphysema, which frequently occur simultaneously in persons who have COPD, are the two primary illnesses that make up this illness. COPD is a worldwide health condition that affects millions of people all over the world and is a major source of sickness, mortality, and high medical expenditures. It is also one of the leading contributors to the cost of healthcare. The causes as well as potential risk factors of COPD. The majority of instances of chronic obstructive pulmonary disease, COPD, are brought on by prolonged exposure to harmful environmental variables. It is estimated that 85 to 90% of COPD cases are caused by cigarette smoking, making it the most prevalent and significant risk factor. Another contributor to the risk is the possibility of being subjected to potentially hazardous dust and fumes while working, which is especially prevalent in industries such as construction and mining. There are certain instances in which hereditary factors have a role. This demonstrates how difficult and complex the connection between genes and the environment can be. Who or what is to blame? The pathophysiology of COPD is complex, and it involves a number of distinct processes that, when combined, result in chronic inflammation of the airways, excessive production of mucus, and the destruction of lung tissue. An inflammatory reaction is triggered by prolonged exposure to irritants such as cigarette smoke, which in turn triggers the production of inflammatory chemicals and the recruitment of immune cells to the affected region. Because of the inflammation, the structure of the airways is altered over time, causing them to become constricted and difficult to navigate. The oxidative stress that is brought on by an imbalance in the body between the antioxidants and the damaging substances makes the damage that has already been done to the lungs even worse. What are the symptoms of COPD? The lungs may experience a variety of symptoms as a result of COPD, the most of which get more severe over time. The following is a list of typical clinical symptoms. A persistent cough that is frequently accompanied by the production of slime is referred to as a chronic cough. Dyspnea, in which a person has shortness of breath, which at first occurs during physical activity but eventually occurs even when the person is at rest. Wheezing, which is characterized by a high-pitched whistling sound that occurs during inhalation. A sense of pressure or pain in the chest that might be described as having a tightness in the chest. These symptoms have a significant impact on a person's quality of life by imposing both physical and emotional limitations on them. Exacerbations are a sudden worsening of symptoms as well as increased inflammation and impaired lung function. Patients who have the condition that is progressing may experience many exacerbations as the disease progresses. How is COPD diagnosed? A physical exam, tests to determine how well the lungs function, and imaging scans are all part of the diagnostic process for COPD. The following are some key steps in the diagnostic process. A comprehensive investigation of the patient's symptoms, risk factors, and family history is included in the medical history. A full body check is conducted on the individual and search for indications such as shallow breathing and cyanosis. Tests of pulmonary function are the most significant tests for diagnosing COPD since it assesses lung function, including the degree to which an individual's ability to breathe normally is impaired. Imaging modalities such as chest X-rays and CT scans can reveal structural issues and help diagnose or rule out other lung disorders. It is essential to have an accurate diagnosis as quickly as possible in order for the appropriate therapy to begin as well as for preventative measures to be done. With what methods is COPD treated? When treating COPD, the primary objectives are to reduce the severity of symptoms, to limit the progression of the illness, and to enhance overall quality of life. The treatment plans make use of a variety of approaches, which include the following. Quitting smoking is the single most significant action that can be done to enhance health outcomes and slow down the progression of the disease. Bronchodilators, which include beta agonists and anticholinergics, as well as breathing corticosteroids, are helpful in relieving symptoms and reducing inflammation. In order to prevent flare-ups from occurring, many people take drugs that have a lengthy duration of action. Lung rehabilitation refers to all-encompassing programs that help persons with lung illness feel better physically and emotionally. These programs include fitness training, educational opportunities, and social support. Oxygen therapy. In the later stages, more oxygen is required in order to maintain appropriate levels of oxygen in the blood. Both lowering the size of the lungs or replacing them entirely are possible surgical treatments for severe cases of COPD. Vaccinations. People who have chronic obstructive pulmonary disease, COPD, should obtain the influenza and pneumococcal vaccinations to prevent diseases that can make their condition worse. How can you prevent COPD? The fundamental objective of primary protection is to reduce the amount of exposure to potential dangers, such as secondhand smoke from cigarettes. Campaigns aimed at promoting public health, programs designed to assist individuals in quitting smoking, and regulations that make it more difficult to smoke in public all contribute to primary prevention. People who have a higher likelihood of developing COPD should have earlier screenings and treatment for the disease. Encourage anyone who have issues breathing, particularly persons who smoke, to get checked out by a medical professional. This may result in earlier treatment and thus better outcomes. In conclusion, chronic obstructive pulmonary disease, also known as COPD, is a significant public health concern that is felt on a global scale. It results in breathing difficulties that last for an extended period of time, in addition to a great deal of disease and mortality. It is crucial to understand what causes it, how it functions, how it manifests itself in people, how it is diagnosed, how it is treated, and how it may be prevented in order to lessen the impact it has on both individuals and society. The key to enhancing the quality of life for persons who have COPD and minimizing the global burden of the illness is early detection, stopping smoking, and thorough care of the condition. In the fight against this pervasive disease, the importance of public health measures that seek to reduce risk factors and increase understanding cannot be overstated. And we're already finished with this episode of Medical for Dummies. We hope you are a little bit more medical educated. Don't forget to like and follow us. See you with the next episode.